Hi there, I'm Andra Duff-Wiskoski. I'm the Administrative Director for Geriatrics, Pharmacy, Quality, Recovery, and Patient Experience at Ontario Shores Centre for Mental Health Sciences in Whitby, Ontario.
Hello, I'm Dr. Wally Bartfay, and I'm the Associate Dean, Undergraduate Studies. I'm also the Director for the Bachelors of Allied Health Science and Health Science programs at Ontario Tech University, located in Oshawa, Ontario, Canada. And today, with my colleague, Andra Duff-Wiskoski, we will be talking about the creation of a clinical demonstration unit which specializes in dementia care. And this unit is located at Ontario Shores Centre for Mental Health Sciences in Whitby, Ontario.
So let's begin by defining dementia. Dementia is defined as a chronic and often progressive neurological disorder that results in a deterioration of mental processes. It is caused by a variety of diseases and injuries that affect the brain. And there are currently over 100 different forms of dementia. Of course, there are various common symptoms of dementia, including confusion, disorientation, personality changes, as well as the development of BPSDs, or behavioral and psychological symptoms of dementia, which include things like wandering and aggression. One thing I wish to point out with this particular slide here is that the incidence of Alzheimer's disease and other forms of dementia are increasing, unfortunately. In 2031, we predict that approximately 1.4 million Canadians will have Alzheimer's disease. And worldwide, this number will reach 115 million by 2050. So let's go over the CDU, or the Clinical Demonstration Unit, Vision Statement. So this is together, Ontario Shores and Ontario Tech University has created a space of technological innovation in frontline care. Partnerships, collaboration, interdisciplinary, and interprofessional approaches will enhance the health and well-being of patients with dementia and also their caregivers. The CDU will transform the geriatric dementia unit at Ontario Shores and will improve patient quality of life and recovery. And this unit will be a benchmark for national and global comparisons in dementia care excellence. Goal of the CDU. In partnership with Ontario Shores Centre for Mental Health Sciences and Ontario Tech University, the CDU will foster and promote research collaborations, best practice initiatives, and experiential learning opportunities. And we will highlight some of these later on in this presentation. The CDU will integrate academic partners into the GDU milieu. The CDU will adhere to the HQO quality standards, adopt best practice, and invent new practice as well. Technology will be integrated to drive practice, and this vision will be realized using co-design and patient and family engagement principles. So let's look at a CDU. Here's a brief overview of it, and this is how it looks like inside on the right. You can see the picture here. This particular unit consists of a 23-bed unit, and it is anticipated that this unit will become a benchmark for national and global comparators in dementia care excellence. The primary patient population is individuals with moderate to severe dementia with significant behavioral and psychological symptoms of dementia, or BPSDs for short.
So the methodology of how we started our work together was that we brought staff and family together in focus groups, separate focus groups, and interviews were conducted to identify priority areas. And the output of these focus groups was that three major themes arose: communication and reducing responsive behaviors, the physical environment, and activities and stimulation. From these three major themes, we then held an idea jam using Google Jamboards in order to brainstorm potential technological solutions to the above needs. The idea jam was attended by university researchers, students, interprofessional staff, and persons with lived experience. And the output from the idea jam was 3 technology areas that could support the opportunity themes identified above, looking at electronic games, virtual reality, and artificial intelligence. From these 3 larger buckets, we developed a seed fund jointly established with Ontario Shores, Centre for Mental Health Sciences, and Ontario Tech University, and an official call for research proposals was placed. Criteria for submissions were that they could be cutting edge, they should be cutting edge, making use of innovative, non-traditional approaches to improve standards of dementia care. The project also must include 1 principal investigator from each organization and should be related to the 3 areas identified in the idea jam: electronic games, virtual reality, and artificial intelligence. The following slide is the framework that we developed in order to execute all of our work for the clinical demonstration unit. You will see above the focus groups and research and the idea jam. From those 2 main events, we developed 3 streams of our work. One which was the research and the call for proposals. The second one was our quality improvement work, whereby we would look at solutions already out on the market and we would implement them on the units and evaluate them. And the third one was our integrated knowledge translation, whereby we would have Ontario Tech University students write on our units, interacting with our patients, and evaluating different solutions.
So let's look at some of these initiatives. The first one we'd like to discuss is the Bright Light Therapy, or BLT for short. And we want to look at the benefits of using BLT as a non-pharmacological intervention for managing BPSDs in patients with dementia. And our clinical objectives were threefold. Number 1, to promote evidence-informed, patient-centered care for individuals with various forms of dementia on the CDU. Number 2, to promote the quality of life of patients with dementia on the CDU via non-pharmacological, patient-centered interventions. And third, to promote and foster interdisciplinary clinical practice to better manage and care for patients on the geriatric dementia unit. The bright light therapy interventions consisted of seating patients 27 inches away from a 10,000 lux light box for 30 minutes twice per day, and these interventions were carried out 5 times per week for the duration of admission. The light box had features of light dispersion and screens that filter out ultraviolet rays as well, and you can see the unit here in the picture to the left. Some of the major outcomes that were observed. We observed in patients who received this particular BLT therapy, reductions in the number of BPSDs observed for patients who received BLT interventions in comparison to their baseline measures. There was also reductions in the number of PRN medications to manage these behavioral and psychological symptoms of dementia. And it was also observed that patients who received BLT therapy reported improved sleep during the night, both quantity and quality.
Another quality improvement initiative that we implemented on the unit was looking at personalized music interventions, or PMI, to decrease the behavioral and psychological symptoms of dementia. PMI is defined as a non-pharmacological therapeutic approach employing music to help clinically manage and/or treat subjects with a variety of clinical disorders and conditions, which include but are not limited to dementia, depression, anxiety, and agitation. A pilot exploratory descriptive study was conducted using PMI delivered via directional parabolic speakers in 4 patients on our geriatric dementia unit. Each PMI session was 90 minutes in total, separated into 30-minute intervals of pre-intervention, intervention, and post-intervention administered twice a week for a total of 4 weeks. A number of BPSD exhibited during each PMI session was assessed, along with a SWOT analysis and a CBA cost-benefit analysis was undertaken. The parametric speakers are speakers that deploy the sound waves in one very small direction and scope so as not to interrupt the other residents or patients on the unit. The results of our PMI study were that out of the 10 conducted 90-minute per session per patient, improvement was a reduction of the BPSD symptoms in 93.75% of the time. Following the completion of PMI sessions, there was a post-improvement of 58.75% demonstrated as well. And both the SWOT and the CBA analysis suggested that the PMI had both clinical, economic, and social personal benefits. These preliminary results suggest that PMI may offer a promise as a low-cost, safe, patient-centered, non-pharmacological intervention to prevent the occurrence of BPSD in patients with dementia. Next are just a couple of slides that show articles that we have submitted in the Science Repository and the American Journal of Biomedical Science and Research. Our new research initiatives, which are coming from, you'll remember, a third arm of our work together was our Big R research, and this called for proposal for research initiatives. So there were 2 successful applicants to receive the seed funding, and one of them was the work in advancing reminiscence therapy through virtual reality to promote social connectedness of persons with dementia. The first objective of this study is to co-design and develop a framework prototype for creating immersive and interactive virtual reminiscence experiences to facilitate the caregiving and management of behaviors and psychological symptoms of dementia. The second objective is to conduct a usability testing of a prototype, immersive, non-immersive virtual reminiscence therapy for people with dementia on the geriatric dementia unit at Ontario Shores. The third objective is to evaluate the effectiveness of this virtual reminiscence experience using non-invasive data analytics and physiological measures, including facial and eye tracking, to provide quantifiable metrics for the evaluation of the intervention. And lastly, to analyze the effects of virtual reality in comparison with other traditional forms of reminiscence intervention that are currently being used on the GDU. The second applicant who was successful for our funding for research is looking at leveraging artificial intelligence and a conversational robot to detect and manage BPSD on the clinical demonstration unit. Their objectives are to develop innovative sensor data collection and efficient machine learning for algorithms for BPSD recognition in persons with dementia, to evaluate the use of artificial intelligence technologies and a conversational robot called Little Sophia to detect and manage BPSD on our geriatric dementia unit, to improve patient monitoring and care, decrease caregiver strain and burden, evaluate the user acceptance of artificial intelligence and conversational robots, and to improve the overall quality of life for persons with dementia. So how are we going to sustain all of this work that we put together over the last year? We have another dementia unit at Ontario Shores, and we are going to expand our quality improvement projects and our research that we're currently doing to the patients and staff on that other unit. And we'll continue to work together with Ontario Tech University to apply for grant funding so that we can sustain our work and our innovation together. Thank you so much.